have my Maddie mug today. Have
Oh,
I told
I love
you?
that. What does it
What?
say?
So I love to write poetry. That's one of my main ways I cope with things. And so my friends made this mug for me out of one of my poems. It says, "Maybe she comes to you with wings," and it's my morning mug some days. Isn't that
Oh
so
my
sweet?
God. That literally, I just felt like a flutter.
I know.
Oh,
I love it. So I
that's
had to
so
tell you this is
beautiful.
why my mug is this one today.
I love that. That's so
Mhm.
sweet. Hi, Mads. She's here with us.
Hello.
All right. Well, hello, friends. We are back for another conversation today. And today we are going to be talking about the impact and, in our opinion, importance of being treated at a children's hospital. We hear it again and again that we talk about how treatments for kids with cancer, kids are different. They need different treatments that are specific to them. And unfortunately, a lot of times that is not happening, but that is a completely different story that we will talk about another time. But that sentiment gets at the heart of exactly of what we're talking about today. Kids are different. Their cancers are different. Their bodies are different. Their side effects are different. There are only positives when you consider going to a children's hospital, a place that specializes in the care for children, being the absolute best place for your child to receive care for their disease.
Mm-hmm. Yeah. And one of the things that I love the most about children's hospitals is that their entire team has practiced particularly with kids. And so, like you were saying, Kate, it's just really amazing that they can have a particular focus on how to get kids better. And I always felt when we were at a children's hospital, it was the best place for us. And I never wanted to look back. Kate, one of the things that you shared with me that I loved was Callahan's oncologist, Dr. Suzanne Reed, gave us some really great details about why being at a full children's hospital, not necessarily a wing of a hospital or a part of a major institution, might be the best fit for kids. So I thought maybe we could talk about that first. Even when we first met, you said to me, "Oh, you should talk to our oncologist, Cal's oncologist," and she was amazing. I emailed her; she got back to me within less than 24 hours.
Yeah, to your point, it's a great place to start because her word really emphatically support everything we're talking about today. So she shared with me, she said kids are not just little adults. Pediatricians say that all of the time. It is the same for pediatric oncology and probably actually for a lot of other pediatric diseases that are not cancer. But she stated kids have special needs that are different from adults. Their diseases and complications are also very different than adults. Pediatric hospitals have doctors and support staff that are specialized and experts in all of those nuances. Non-pediatric hospitals are less familiar and equipped to take care of those needs. And a good example of this is even the quote unquote same type of cancer. So, in our experience, Callahan had infant ALL, which even further nuance is actually a different disease than childhood leukemia, childhood ALL. But in the vein of what we're talking about today, childhood leukemia and infantile leukemia are treated completely differently than the way adults are treated. And their treatments and protocols are different. They might receive all of the same drugs that adults get, but the protocol is in a very different way to be specific to how children's bodies manage those therapies.
Exactly. We were at 3 different hospitals through Maddie's cancer journey. We started at our local hospital, which happened to be a children's wing of a major hospital in the area. So we were 20 minutes from there, which was awesome. So that meant that Dan and I could go back and forth every night. The transportation and access part for us was great. However, I would say there were a lot of things that happened at that hospital after we switched to another full children's hospital and moved states to do that, that I would never have understood and realized had I not been through that experience personally. And so that's why for me, advocating for people to get to a children's hospital, if you have the ability to do that, can be life-changing for your child. Something as simple as the urgency of saying, my kid can't wait for this,
Mm-hmm.
happens at children's hospitals, and they usually put babies first on the list of surgeries for the day, as an example. Or if someone is extra sick, they can do surgeries no matter what time of day it is. If it is first thing in the morning, 2 a.m., and something happens, they can wheel you in for a CT scan. Versus at an adult hospital, you have to wait for those things to have the children's CT scan ready. You have to have the children's piece of this ready, which is usually not available on the weekends. And so it becomes this game of, oh, when can we get them in for their treatment? Rather than what's best for this child based on their needs right now. And I thought a great example of this for us was that when Maddie was in the hospital that was not just a children's hospital, when she would get an MRI, or if she had to get a surgery where she couldn't eat anything, which is everybody. Like if you're going under general anesthesia, typically you can't eat after 12 p.m. that night or whatever the hospital says. But there are actually different rules based on if you are breast milk fed versus formula, how old you are. And there are a lot of studies that show that infants don't need as much of that time in order to keep them safe under anesthesia. I think there was one day she didn't eat for like 15 hours.
Oh my
This is
God.
a 4-month-old child. 15 hours of waiting, and no one would give us any answers. I would go down the hall. What time is she going to go get her biopsy now? Can she eat? And nothing. Zero. Crickets.
It's so frustrating.
And so for me, that's just one of many examples that I could probably talk about for days.
Like why it's so important.
Why it's so important to be at a children's hospital. Even from the equipment, how, doctors and specialists, we could get into that too. But Kate, sometimes I get so frustrated talking about this stuff because I feel
you go
like
back there, you're instantly back in those moments, and like it's so crazy because I'm remembering similar instances. Even we were at a children's hospital, and it was not an oncology specialist, and I think they typically dealt with older kids, and so the time was like 6 hours, I think, for an older kid. And so they just came in the room, and he had a procedure at like 6 a.m. the next morning and said, okay, NPO means nothing by mouth. So they were giving instructions to the night nurse and said, NPO starting at midnight. And I was like, I don't think that's right. After that person left, I rechecked in with the nurse. I'm like, I'm pretty sure his last meal can be at 3 a.m. because he gets breast milk through his NG tube. And breast milk is 3 hours before. You have to be the advocate for your child. So just say something, And the nurse was like, oh my gosh, you're absolutely right. That was a mistake. We're talking about infants here. But for any kid going a long stretch without food, in my experience and Jackie's experience, specifically for an infant, missing one meal is a huge deal. What he was getting done in that instance might have had something to do with his liver. I think that's why there was a different specialist. And after liver biopsy, you can't eat right away. If he ever had a bone marrow biopsy or a different procedure, you can eat right when you get out. And literally every hour counted. So yeah, that 3 a.m. last meal versus the midnight last meal makes a big difference.
And one of the things is that when you're not at a children's hospital, the number of people who are truly experts in working with children declines because the funding isn't there. So at our first hospital, as an example, there were 2 social workers I think maybe even 1 social worker for the entire group of people. versus at full children's hospitals where you could have up to 20, 25 for everyone. Obviously, there are more children that are being seen. And so, it's also a game of how many people can support each other. But you have the social workers, child life specialists, not just behavioral health specialists, which might only be available at, adult hospitals that also see children. The medical supplies at another hospital, very famous cancer research hospital, world renowned. Their PICU is only 5 beds for kids.
Oh my God.
5 beds. That's it. They don't have the capacity to treat all of the things that happen with really sick kids. They have actually send them across the street to a different hospital, which we didn't know at the time when we transferred there.
When you guys went to that hospital, it was like you guys were there and then you left.
We left. Yeah. We took an ambulance. Maddie was very sick at this point. I wanted to caveat. So she had already, her disease had switched from ALL to AML. We can talk about that later too, but this very rare thing happened. And so we had to get on a trial, and this was our best chance of her getting better. And so we decided to take her from a full children's hospital to a smaller hospital because the full children's hospital didn't have the current trial approved.
Another problem. But
right? Lots of issues here we're bringing up for you guys. Sorry, but this is why it's important to be that the collaboration that I saw at our heart hospital, which I say heart hospital because like I love them so much and they're like family to us now. They did everything they could in their power and collaborated across all of the different hospitals and systems to try to get Maddie better. They did everything they could. They had a plan A through Z the entire time we were there. Versus everywhere else, we would get there and they'd be like, oh, well, maybe we could try this or maybe we can try that. And I was like, no, this is not how it's going to work.
For us, we live 10 minutes from a wonderful children's hospital. And so when our delivering hospital was like, we think he has cancer, it was just, we didn't even need to think, that's just where they sent him. When we were having, and I think maybe we talked about this in our diagnosis story, it was an open conversation of, we will reach out to other children's hospitals to see if there are clinical trials available. I was like, oh, wow, that's so great that you guys work together. And I remember our fellow was like, yeah, like that's a big difference between children's hospitals and adult hospitals. And I don't know if he was talking generally or specifically for oncology. I would imagine it's probably across the board. He said there is a competitive element in adult hospitals. They want to keep you, they want to retain the patients, whereas children's hospitals, they are truly patient focused and they will do whatever they can to get that child the care that they specifically need, even if it means leaving their hospital. Another example, another family we saw, there was no protocol for their child. Their child had a type of brain cancer, and our hospital consulted with St. Jude to say, hey, there's no protocol for this. This is what we're thinking of doing. What do you think? And they worked together to give this child their best chance at survival. And that is, for such a horrible nightmare situation to be in, that's such a beautiful thing.
This is going back to that thought of feeling empowered to make decisions about your child's care, because that's such a beautiful example of hospitals coming together, because our kids, no matter where they come from, how they identify, who their parents are, who their guardians are, children should receive life-saving treatments, period.
Yeah,
right?
Totally.
And if you ever feel as a caregiver, as a friend or a supporter that that's not happening, you need to speak up, because we also had that experience of our doctor at our first hospital, which is not a full children's hospital, saying, oh, here's our email address. You can email me if something goes wrong. And at first I thought that was normal until I talked to you, Kate. And I was like, no, that's actually not normal. Yeah. These amazing doctors who are truly invested, and not to say that they weren't. However, they just didn't have that same level of understanding of the disease that she had.
Yeah.
That he had. And so if you're on protocol, if there's a protocol for you, it's not to say that these hospitals aren't good to treat that. What we're trying to say is that you, as the advocate for your child, are allowed to explore and push and ask questions. And if you're not getting those answers, know that there are so many, so many amazing doctors in pediatric oncology and also throughout the whole system. We worked with every doctor possible who care so deeply and will give you their cell phone number. They will give you their email address. They will give you their they will do anything. They'll call to check in randomly on a weekend. You can call them whenever, and that's what they want to do. And so I just share that as someone who had this feeling of, oh, wow, I guess no one really cares about the outcome of my daughter. I have to do this all by myself.
Yeah.
There are people who care, and you just have to find them. And
well, and I think I just want to like reiterate the point that you made. It's not, I don't think it's that they don't care. I think it's exactly what you said. I think they don't fully understand. And I will say, I remember when you guys were at that first hospital, and that was when you and I met. And I remember feeling very nervous, and like, I felt the urgent, because I was like, I feel like this hospital like doesn't understand what this is. And like, kids can't wait. That's why, like, as soon as you were like, nope, and you started like running down the path of like going to a different hospital, I was like, this girl is so badass. Like, because you saw that and you were like, no, we're done here. This is not the right place to be. And again, I just want to say, like, I don't think anyone has ill intent at all.
No.
But you, as the parent, you are concerned about your one. That's your priority. And I think when you go to a children's hospital, you feel more of that, like, this team cares like as much as I do.
Yes. Kate, I'm not even kidding. I walked into our hospital for the first time where Maddie that's our family now. I remember going into the clinic and there were handprints everywhere of kids. And the elevator even had like a kid voice. And I just started crying because I was like, oh my gosh, this is where we need to be. And I just knew it. I had this like instinctive feeling that was just like, here we are. And we walked in to our first clinic visit with our nurse practitioner. She immediately was like, oh, I've been so excited to meet Maddie, or the doctor that we talked to online, who is one of our favorite people in the whole world now, was talking about her. I really did feel this weight lifted of like, this isn't all on me anymore. We have this team of people who can help now. Because I was navigating, and you remember this too, Kate, when we were trying to switch hospitals when Maddie wouldn't get into remission, because that's also a good point within this conversation is that going back to protocol versus non-protocol, if your child is on a protocol and it's working and your child gets into remission, there's not as much of a reason to change what you're doing because it's working.
Right.
It's when it's not working, when there's no protocol, that you need that team of people who really understand how to make decisions really quickly. And once you get to a children's hospital, though, that's full children, then you have your nurse navigators, you have your cardiologist, you have your nephrologist, your urologist, you have like literally everyone, and everyone specializes in children.
Well, and I think that's a great point. Two other points I'm going to touch on based on what you just said. So first of all the different specialists. Dr. Suzanne Reed also made this point, is that children's cancers come with like a myriad of side effects that are different than adults. And so you need lots of specialists. Like, we basically met with almost probably every specialist at children's. Callahan had severe liver damage. It's still something that we look at today, but that was the reason his transplant was not able to happen. So hepatology, cardiology, infectious disease. And to this day, sometimes I feel like people are like, oh my God, your kid was diagnosed 3 years ago. He's in remission. He's off treatment. Like, is this like your entire personality right now? But I'm like, yeah, It's not my whole personality, but this still impacts literally every single day of my life. We are over 3 years out from diagnosis. We're a year off of treatment, and we are still in 4 different support therapies because he is severely behind. I mean, severely might be aggressive, but he is significantly behind. He is 3 and he is about like where a 2-year-old is. So yes, like this is in my face every single day, like the repercussions of treatment. We still have follow-ups with infectious disease and cardiac. They're all things that are still like part of our journey going forward. So that was one point that I wanted to make. You have the specialization of all of those specialists that are specialized for children for all of the nuanced side effects that they very likely will experience from these toxic treatments. And then, Jackie, you made the point about when you got to your heart hospital. I love that. How everything was specialized for kids. And that is such a great point from a, I guess, like psychological, mental perspective, just the environment. Everything is catered towards kids. So the layout of the rooms are child friendly. The types of play that they have, not only with like the child life specialists and music therapy and art therapy, those are super important too. But like every room in our hospital had hanging on the wall one of the fold out mats. The kids could play on the floor.
Well, that's so nice.
Every room had one. The gift shop, the types of food that's in the cafeteria. Suzanne Reed also touched on this too, and talking about the importance of it is that what these kids are going through is incredibly traumatic. So if you have an environment that is friendly to them, if you have staff that is specialized in caring specifically for children, you are going to lighten that blow to what is happening to them and how they are experiencing it and how they can manage it. And that is incredibly valuable.
Absolutely. And one of the things that I also love about children's hospitals is that ability to make quick decisions without having to consult someone else, which
Such
is
a
a
great point.
big deal. When you're at a children's hospital, it's all people who understand children. They're all making decisions. They're making their best guess because some of medicine is art too, especially when it comes to, cancer, right? It's not all going to act the same. Every body is different. Every child is different. And so you're making these quick decisions. I remember there was one time when we were at clinic and we had our doctor come in and Maddie was not in remission to get a game-changing immunotherapy, that treatment that we were there for. And she was like, we have this one drug in the office and we can get it approved today. If we had been anywhere else, we would have had to
You wouldn't have known.
there was no way that we would have been able to make that decision so fast. And I actually got to see her the other day and I told her that story and I said, I don't know how much you understand how impactful that was for us. We were literally in a room, we got labs back and you laid out the decision, the A, B, and C for us, always A, B, and C. And we made that decision right there.
It's truly incredible. And
yeah. And I also want to reiterate, Kate, that a lot of when I met you, it changed my world.
oh,
But like
mine too. I was like, I have a person.
But even the way that I saw you advocating and doing all of this research and learning, I thought, oh my goodness, I didn't know that I could do this. And that's where I hope this helps other people is I hope that I hope everyone else gets a Kate.
Oh,
For me, it really, when we went to other hospitals, they were like, oh, why aren't you making a decision sooner? This should have been decided weeks. When you're a parent and you hear something like that, I mean, every time I go back to those moments and I feel guilty. I feel a sense of I should have been better. I should have known more.
But you don't, and I'm sorry I keep interrupting you in this conversation. I think this is so important to, again, say to you, but to say to anyone else who might be listening to this and feeling that same way. You can only make a decision with the information that you have at the time.
Mm-hmm.
And I think that is really easy for me to say, but there have been other specific instances that we'll probably talk about in a different scenario. You beat yourself up a little bit for them, but I would have made the same decision. You learn things over time. And that's exactly why we're doing this
Yeah.
podcast, because there's so much information coming at you and so many different layers to this. People can only tell you so much at once because it is so overwhelming. So
Overwhelming. Thank you.
anyways, it might be easy to say, but make it a mantra that every decision you make is coming from a place of love, and you can only make a decision based on the information that you have at the time.
I love
You're
that.
doing the absolute best next step forward that you knew.
Yeah. And that's right. And I think, and then when I come back to it, I'm like, yes, okay. Yes, Jackie, we did, you and like we were a team, me and my husband, we did everything. We made decisions together. So it's not just me. We did everything we could and we moved 3 times. We went to the children's hospitals. We went to different trials. And so I guess sharing that, I hope that it helps other people feel better. No matter what happens, it's so hard to navigate this world. And, we really hope that this at least provides an example of every decision is in love and you can make another decision. And also, you don't know until you know. Then we will be behind you. We will have your back. We can talk about all this stuff. Going back to why we wanted to talk about children's hospitals, that's why I believe full children's hospitals, with the support systems put into place with the correct funding, are the best places for kids. And I have to say, with the caveat of, we were very privileged to have great insurance. We could move because of our community of support. We had the funds to be able to do that. And access is not there for everyone. And that is a reality that is systemic within our country. And so we recognize that this is not an option for everyone, too. And if that's a decision that you have to make because you can't do that because of, funding, or you just can't move because you have other children or there's some other reason, again, that's not in your control. One day, I hope that that is not an answer that we have to give. There are a lot of nonprofits out there doing work to give folks financial resources, and we'll link to those in our open access. But just to say it is not a perfect system. There are a lot of holes in it right now. If a child deserves the best care possible, no matter what.
I would just want to kind of like underline, if that is you, if that is a sentiment that you identify with, you should always still feel empowered to get a second opinion, to do research and try to get your child what you feel like is the best care for them. And, we talked about this in our last episode, and we'll have it linked on our Instagram and we'll link it in the show notes. But the resource guide we're putting together, it's built for everyone, but especially for people that might feel like they have more restrictions.
Mm-hmm.
So what are those nonprofits in every state, region that can help families financially? What are the organizations that help find temporary housing for people?
Mm-hmm.
What are the organizations that can give just general financial grants to families so that they can, even if they don't have to move, if they have a job that is not flexible, so that they can still pay their bills and take care of their other children. So that is something that can be a resource. Again, if that sentiment is something that connects to you, there are still options out there.
Mm-hmm.
Don't feel like you're running into a brick wall. There are organizations that are built specifically to help solve these problems because it is a massive problem.
Mm-hmm. there are, like Kate, you were saying, I think that's such a beautiful, positive point to kind of end on too, is that don't give up. There are so many resources out there. We will share as much as we know, and you can still feel all the feelings that you feel, and also know there are so many people who want to help.
Yeah, absolutely. That's a big thing. People want to help, especially us, which is why we're here. So, I think we will wrap this episode up. This is a huge topic. We initially thought this was going to be a mini episode, but we're like, no, there's too many reasons to talk about here.
As always, thanks for joining us. We hope this conversation made you feel seen and heard.
Yep. And until next time, we hope this helped.